So I posted a link to a website that I often use, and here is where you can find a list of prefixes, word roots, combining forms, and suffixes for this particular topic. So, blood, lymph, and immune system. As we already know, the word parts for blood are hemo, hemato, but we also have a suffix for blood, and that is emia. For example, the study of blood is hematology. Blood is composed of formed elements or cells. We have the red cells, erythrocytes, leukocytes, the white blood cells, and thrombocytes, which are platelets, but literally it means cells for clotting, because thrombo means clot. So eryther, red, leuc, white, thrombo, clot. All of these cells are suspended in a liquid called plasma. The combining form is plasmo. The lymphatic system. Lymph nodes, lymphadeno. Example, lymphadenitis, inflammation of lymph nodes. Although we know that adeno means gland, so lymph nodes, lymph glands, just the same. Lymph vessels, lymphangio. Lymphangectomy is the removal of lymph vessels. And then for the lymph fluid, the one that flows through the vessels, we just call it lymph, and the combining form is lympho. Okay. Other organs that belong to these systems include tonsils, tonsillo combining form. There we go. We have tonsillectomy as our example. The thymus, which is found antero and superior to the heart. And then we have thymoma for an example, a tumor of the thymus. The spleen, which is that purple organ on the left side of the body. The example here is splenomegaly. So the word is spleen with a double E, but the combining form is one E, splen. So I want you to do some medical word exercises. Here you go. Feel free to pause this part of the video, and as usual, the answers will be available in the next module. Miss T complains of fatigue and headaches and appears pale and listless. She says her periods have been excessively heavy for the last year. A CBC or a complete blood count shows low hemoglobin and hematocrit. Those are blood tests that are included in a CBC. The differential, another test part of the CBC, the differential shows small and pale red blood cells. The tentative diagnosis is, let's see, these are three types of anemia. Pernicious anemia, this is a vitamin B12 deficiency. The cells are usually large and pale. And then we have iron deficiency anemia. Just a reminder, AN is the prefix that means without, and emia is the suffix that pertains to blood. So just what it says, the anemia is because of lack or deficient iron. And then the third type of anemia here is sickle cell anemia, where the red cells assume a sickle shape. So based on that, I hope you got the answer for that one. This one is iron deficiency anemia. So another blood disorder is leukemia. Literally, it means white blood, but it's not white blood. It's the malignancy of the bone marrow where you have proliferation of abnormal white blood cells. They're abnormal, they're not able to carry their normal function, and there are two general types of leukemia, the one that is sudden, also known as acute, and chronic, which is long-term or the gradual type of leukemia. So these are the signs and symptoms of leukemia, and I underline those that are medical terms. So asymptomatic sometimes, meaning it does not show any symptoms, but oftentimes there's fatigue, malaise or weakness, easy bruising, exercise intolerance, there's night sweats, and then there's arthralgia or arthrodenia. If you remember, that would be pain in the joints. And then you have splenomegaly and hepatomegaly. That would be enlargement of the spleen and the liver. You can also make that one word, splenohepatomegaly or hepatosplenomegaly. And then we have lymphadenopathy, which is disease of the lymph nodes. Lymphedema. When there's too much lymph in the body, it starts to leak out of the vessels and accumulates between the tissue. The term there is lymphedema. So edema is the suffix for swelling. You could see in the picture that there is abnormal accumulation of the tissues, of the fluid in the tissues. You have an enlarged left limb. And this is common in the limbs again. It can be caused by many things, from injury to tumors to parasitism that can cause the blockage of the lymphatic channels. Mr. M is scheduled for a treatment that administers natural immune substances produced in a lab to destroy cancer cells. What type of treatment is this? Again, you give natural immune substances to the patient. So is that hormone therapy, chemotherapy, or immunotherapy? I hope you guessed it right. That is immunotherapy. Here's another disorder, SLE. SLE is systemic lupus erythematosus. It's an autoimmune disease. There's autoantibodies that attacks the patient's own skin, joints, and other organs of the body. So lupus, the origin of that word is lion, and erythema, as you know, is red. But again, that is just to word etymology. You know, it's not the actual medical definition of the disorder. Thrombocytopenia. So before I show you the meanings of each word part, let's remember our suffixes. Penia means decrease, cyto is cell, thrombo is clot. So, but instead of saying clot cell decrease, remember we always start with the suffix, a decrease in the cells for clotting. Basically a decrease in platelets. And this is the most common hemorrhagic disorder. If we break down hemorrhagic, it means hemo, blood, rage is bursting forth of blood. So there's a lot of blood loss for someone who has thrombocytopenia. Okay. The next medical term we have here is, the medical word part is pheresis. Sorry, I just need to charge my laptop there. And so if we want to transfuse blood, we use the suffix pheresis. For example, if we want to transfuse just the plasma, then we add the word root plasm, and then we have the combining vowel O. Sometimes it's the combining vowel A. So plasmapheresis is also correct. We can also just transfuse the white cells. We can also just transfuse the red cells. You know. And there are two types of blood transfusion listed here. Autologous, meaning you are the donor and you're also the recipient. You're donating to yourself. How do we explain that? You know, when you have an elective surgery coming up, you will have your blood extracted, you know, save it in a blood bank refrigerator, and when the time comes that you need it, probably in a month or less, then you don't need to use other people's blood. And homologous is the transfusion of blood coming from a donor of the same species, so another human, whether it's an identical, whether it's a relative, a friend, or a stranger, homologous. And that is an image of plasmapheresis. So you're not transfusing all of the blood, you're transfusing just the plasma. Mr. G is diagnosed with a thrombus. To dissolve the thrombus, the physician will prescribe a, let's see, do you need immunization to dissolve a clot? Do you need to suppress the immune system? No, you need a thrombolytic. The suffix lytic, after all, means dissolve or break down. To prevent the formation of a post-surgical blood clot, the physician will prescribe a, so basically after surgery you don't want the patient to form blood clots, you will therefore give them an anticoagulant. Anticoagulant means against clotting, so the blood will not clot. Immunosuppressant, well, to suppress the immune system. This is given to people post-transplant. So, the body will take time to accept the new transplanted organ instead of reject it by your immune system. And thrombolytic, once again, is an agent that will dissolve or destroy a blood clot.